So, Randy, I'm going to actually let you take it away and introduce the program today. So, thanks everybody for coming, and I want to thank all of you for being here this morning. And again, Randy, you've been a lifesaver. So, welcome.
So I'll just say the name of the program, just for everybody's reminding: Crisis Prevention, Long-Term Care Planning to Protect Your Health and Wealth. And we have a group of panelists who are going to help you understand ways to avoid medical chaos and to prevent financial disaster, because those things can happen when we're not prepared. I'm going to turn it over to Meryl, and she'll introduce herself, and she's going to moderate today.
Hi, excuse me. Hi, everyone. My name is Meryl Griff. I'm an attorney and also a licensed insurance professional. I have made an entire career out of crisis prevention and crisis management. And it is truly my pleasure today to moderate this panel of some of my favorite colleagues in various sectors of the crisis prevention planning and care industry. So I'm going to introduce my first colleague, Lisa Baer, who is a fellow attorney. I'll give you a little bit of background about Lisa. I'm happy to also, during this seminar, if you have questions, please either put them in the chat or raise your hand. We will get to them. And we are just very happy to be here. And I am personally very happy to help get people necessary information, hopefully in advance of anything that may come up for them in their care journey. So to start with, my colleague Lisa Baer is the co-owner and co-founder of LMR Elder Care, which is a geriatric management company. Like me, Lisa is an attorney. She is also, however, a board certified case manager, which is a CCM, and an advanced professional member of the Aging Life Care Association. Lisa is a geriatric care manager and a patient advocate. She uses her legal and her social services experience to advocate on behalf of her clients and their families. And I'm here to personally also tell you that there's no one better. So Lisa, thanks for joining us today.
Great, thank you. So it's actually my pleasure to be able to introduce the highly esteemed Randi Brokman. Randi has worked with seniors in social, educational, cultural, and entertainment programming for the past 16 years. And for the past 2.5, she's been working with home watch caregivers, helping to ease the stress on families when they're dealing with family members who need care. A little bit about Home Watch. Home Watch Caregivers of South Orange provides premier in-home and in-residential facility care services with trained certified caregivers. They are recognized as a high-touch, high-service home care provider in Essex, Union, Passaic, and Morris counties. They're focused on customized care for individuals that preserves dignity, protects independence, and provides peace of mind for the entire family. They understand that when a loved one needs a caregiver, the entire family is impacted, and they are proud to be best of care leader and excellence provider and employer for 7 years. And on a personal note, I have worked hand in hand with Home Watch caregivers since they opened. I want to say it was probably around after we opened in 2006, so somewhere around the same time. I've worked with them all this time. And Randi is not just a professional colleague, but has become a dear friend of mine, as have the other panelists on this group today. So thank you.
So I'm going to take this opportunity to introduce you to Donna Plotnick. She's the founder of Senior Living Partners, a family-owned company based in northern New Jersey. Donna's been working in the geriatric community in healthcare in New Jersey for 20 years, and she provides families with peace of mind as her mission. It's not just her mission, it's the way she works all the time. They support families throughout the entire process of finding proper living situations. So when somebody is in need to move or to find the right care, she knows the facility, she knows what she knows everyone in the field, and she knows the right facilities. So she helps go through the entire process of touring, paperwork, moving, discharge, hospice, home care, There's no service, there's no cost for their service. They're compensated by their care partners with whom they work. And they're a trusted local source for information, advice, and guidance about senior living options and senior support services. And I can say that Donna and I work together very closely because families that are looking for new care for their family members, sometimes it's a facility and sometimes it's home care. And we work together to find the right fit for the family and for the senior. Okay.
So I think we're all set, right?
Yeah. Yeah, we're all set. And so we can start with our readers. Who's our first reader?
Well, maybe let's tell people what we're doing.
Yeah, I did. We have 3 readers who are going to review a scenario which we put together to bring up issues that need to be addressed when somebody is in crisis.
And our goal today is, rather than give everyone lists of information, is to pull it together in a way that is just more relatable and will help us all understand better how the process may work. So I think if we have our first reader, we can start reading it.
Beth, can you be our first reader?
Sure. How much am I reading on this?
First 3 paragraphs would be great.
3 paragraphs? Okay. Mom, Carol, is married to Dad, David. They are 77 and 83 respectively and live in a 2-story townhome in North Jersey with their small dog. Their grown daughters, Amy and Beth, both work full-time. Amy lives in Cherry Hill and Beth lives in Pittsburgh. A couple of years ago, Mom noticed that Dad was becoming more forgetful. She began to remind him of things that he forgot, drove him when he needed to get somewhere or when they needed to do some errands, and she made sure that he was not alone very often. One day, Mom tripped going down the stairs in the townhome and broke her hip. She was taken by ambulance to the hospital where she stayed 5 days before being transferred to a subacute rehabilitation facility. Beth drove 7 hours from Pittsburgh to stay with Dad. She was shocked to find how forgetful Dad had become. The fridge had spoiled food. The mailbox was overflowing. Dad was unshaven. His clothes were filthy, and there was pee and poop all over the house from the dog. Beth took in the mail, cleaned the fridge, arranged for a dog walker, hired a remediation service to clean the mess that the dog had made, and helped Dad take a shower. When it was time to go to visit Mom, Dad became angry when Beth insisted that she drive his car, so they took hers.
Next reader.
Amy, meanwhile, was trying to figure out what would happen after Mom was discharged from the rehab facility. After Beth reported the situation with David to her, Amy realized that Mom had been caring and covering for him and would now not even be able to care for herself. Initially, when Amy called the rehab social worker refused to speak with her. Evidently, her parents had not gotten around to executing their healthcare proxy, advanced directives, and durable powers of attorney. They talked about it for years, but they just kept putting it off. The social worker finally got permission from Mom to speak with Amy and dropped the news that her mom was being discharged home the next day. She emailed Amy a list of home care agencies, then told her that she was going into a meeting and would be out of the office for the rest of the week. Amy was concerned that Mom was not ready to go home. She had only been there a week and told her daughters that she could not get to the bathroom on her own yet. Amy did not know if Mom had appeal rights, and she desperately tried to squeeze phone calls in during breaks at work to arrange putting next steps in place. But it was challenging trying to use daytime hours for both work and research calls. Amy and Beth were in unfamiliar territory. They just didn't know what they didn't know. To make matters worse, Beth needed to get back to Pittsburgh to deal in person with a major work event that had taken place while she was away. She is the main breadwinner in her family and could not afford to lose her job. It was senior year and Amy's son had lacrosse finals, prom, and graduation. She wanted to help her parents, but she didn't want to miss out on her own family special events. Amy and Beth knew that eventually the family would have to consider a residential facility for Dad. Without Mom home to cover, his dementia became more apparent and he deteriorated. He regularly called Beth Carol and was spending his nights wandering around the house. Everyone was afraid that he would fall or worse, leave the house and get lost.
Amy, Beth, and Carol were scared and overwhelmed. They did not know what they needed to do to keep David safe. They just knew that Mom could no longer be his primary caregiver. Mom needed to focus on her own recovery. She had not been taking great care of herself over the past year. While she was in the hospital, they diagnosed uncontrolled high blood pressure and borderline diabetes. The sisters did not know how to find in-home care for Mom and Dad or how much and what type of care was needed. They also knew that David would continue to deteriorate and would need facility care, but they did not know how to find the right one. Everyone was worried about the potentially staggering costs of care, but there was some good news. David and Carol had long-term care insurance, and they had taken out several insurance policies when they were younger. Fortunately, all the policies were in good standing as David and Carol had set up auto pay a couple of years ago. Amy was also willing to help out a little, but Beth could not afford to do so. With the help of a team, Amy and Beth were able to help both of their parents create a meaningful and practical legal, financial, insurance, and medical plan of care. In addition, after going through what they did with their parents, team members helped Amy and Beth create a plan that includes regular review and updates so that their children would not find themselves in a similar situation down the road.
Great readers. Thank you.
Wow, that was that's a lot for one family, although I'm sure my fellow panelists would agree. Unfortunately, while it's a lot for one family, it is not atypical. I know one of the biggest questions when a family situation starts unraveling in one direction or in multiple directions, as we have here, is where do we start? And I know if I had to figure out where to get started, Lisa, I would be calling you. So how do Amy and Beth begin to dig in and manage in a case like this?
Okay, so thank you for those wonderful readers. So probably what's front of mind right now is that Carol, the mom, is still in the subacute rehab facility, and we need a plan for her to go home. And what we're looking for is what we call a safe discharge. So first of all, she does have appeal rights. I don't know if anyone, we're going to definitely open this up and like you can raise your hands or put it in the chat questions. But I would imagine that many people on this call have had the experience of caring for someone while they were either in the hospital or at a rehab facility. And sometimes the rehab facilities will just be like, all right, you're going home tomorrow. But there are appeal rights. You have the right with Medicare to appeal. And so Carol does have rights to be able to hopefully stay and prolong her stay so she can get a little bit more help and be able to get to the bathroom herself and things like that. She also wants to make sure that the social worker the family wants to make sure that the social worker who is, I guess, going out of the office for the week, we want to figure out who's going to be the person that's going to take ownership of this at the subacute facility. We want to make sure when she goes home, she has all the things that she needs. She needs home care. And I'm going to pass this to Randi to kind of explain that process in a second. So she needs, perhaps they will need to make arrangements for durable medical equipment to be delivered to the house before Carol gets home. Maybe she'll need some, additional physical therapy, occupational therapy. We don't know if she has any wounds or anything like that she would need a visiting nurse to come out. So that would be something else that's all arranged while she's still at the rehab facility before she goes home. And one thing that's kind of standing out to me, which I do want to mention now, is kind of, and I won't dig deep into them other to say the names of these documents, but it's really important, as we kind of saw from Carol's, the social worker's reluctancy to speak with a family member without the proper authorization. There are certain legal documents that everybody over the age of 18 should have in place. And I'm not talking about a will. A will is for, after you're gone. I'm talking about the things that you need while you're alive that will help you make decisions for yourself and help other people make decisions on your behalf if you are unable to. And all this is in order to avoid guardianship. So I don't know if anyone on this call, knows what guardianship is or has experienced it themselves. But in order to avoid guardianship, which is always our goal, is we want to make sure that we have a durable power of attorney in place for financial matters. We want to have a healthcare proxy in place, which is a power of a health, sometimes called a healthcare power of attorney. So someone who can make medical decisions if you no longer can. We want to give HIPAA authorization. So, when everyone goes to the doctor and they fill out like a paperwork, who can have information, access to their protected health information. We want to make sure that anyone that the family wants to list. So it may be other medical providers. So you want to be able to have other doctors call in and speak and perhaps help with the coordination of care. And we also want to make sure that the person, him or herself, Carol in this case, completes something that we call an advance directive, or you might have heard the term living will, which is really the set of directions for the person who's going to act as the healthcare proxy to be able to know what a person wants. And I'm going to say, God forbid that they're in this situation, but if someone has to make an end of life decision, it's really helpful to the family. And what I actually call, when I do speaking engagements, a gift, when someone has completed their advance directives and nominated and given the authority to a healthcare proxy. Because if you are in a position where you have to make a life determining decision for someone else, you really want that set of directions, that advance directive or that living will, to be able to tell your agent, the person who's acting for you, what you want. Otherwise, they're guessing, and they may substitute their own judgment, which really won't, necessarily be what you would want. So those are some documents that I'd like to suggest that the family get in order. And really anybody over the age of 18 should have this, as I mentioned. So, what I'd like to do now is I'd like to kind of pass this on to Randi, if you could, to talk about the process for, determining home care, kind of even the transition, whether a person's coming from the hospital or from rehab, and how that works.
Lisa, before we do that, I just wanted to ask you, in this case, you were referring to that paperwork for Carol, but what about the husband who has some, who might be able to, might not be able to, depending upon the level? How do you handle that?
Yeah, so that's actually a really good question, because depending the level of David's dementia, the dad's dementia, an attorney may or may not be willing to complete these documents. And so that's actually, it's a really good question. And it's something that I'm kind of faced with in my practice every day, kind of what is the level of capacity and dementia. Now, in New Jersey, the legal standard is pretty low. So, you really have to be able to just understand what it is that you're signing. I will say that, but attorneys are also very afraid of being sued. And in my experience, they may record, they may, have witnesses there, but they're not looking to put themselves out on the line. So we really want to get these documents done as soon as possible.
Yeah, I would just jump in there from the legal perspective and say that the most effective and least expensive way to go is to have those documents done yesterday even, or at least today, and not have to have a case-by-case analysis from the attorney. So really that's why this seminar is so much geared toward prevention, because these documents are a small part of a pre-planning process that can make everything else that much easier if the wrong thing happens. So that's why we're here to share, sort of the ounce of prevention as opposed to the pound of cure you will need from the attorney on the documents.
And then, kind of to follow up with Randy's question, if the dementia is so bad and there's no attorney that is really willing to take on that responsibility of completing the documents, we are faced with something called guardianship. And guardianship, if you just, kind of think of it, we have guardianship of the person and guardianship of the property. And it's, if you have children or grandchildren, the parents have responsibility and legal guardianship of their children until they are the age of 18. At the age of 18, when someone is emancipated, at that point, we are free to make our own decisions, and including bad decisions. And so what happens on the kind of other ends of the spectrum is if a person, and I don't want to even say older adult, because I've seen, 18-year-olds, a person with a disability, you still have to go through the guardianship process. It's not an automatic thing that happens. But if we can prevent it, as kind of Meryl and really the point of this whole call is to prevent that thing from happening, we want to avoid guardianship. Guardianship is
also much more expensive, right?
Incredibly expensive.
Yes.
I mean, I've worked on guardianship, in the six figures without a doubt, because if someone contests, let's say, Meryl comes forward and says, I want to be Lisa's guardian. I haven't done my documents. I need someone. But then Meryl says, you know what? I think I'm going to do a better job. But then Randi comes in and she says, no, I'm going to do a better job. And so now we have, 3 and 4 attorneys involved, an attorney that's going to be appointed to represent me. And it becomes a very litigious and very expensive proposition. And it literally drives families apart. So we want to do everything we can to avoid that. So that's a really good question, Randi. Thank you.
Just especially at a time, these things, if you're talking about taking care of this paperwork at a time where the family is under tremendous stress with the medical situation, you don't need to have both a legal and a medical issue to deal with at the same time. So that's why the paperwork is really important to do ahead of time as much as possible. And in the scenario, hopefully the 2 daughters will take care of their paperwork in advance.
I just want to ask a question here, because I actually don't know the answer to this. If a family does need to consider residential care for a member of the family who is no longer able to really make their own decisions about residential care, Donna, how do those papers play into what you do?
Well, before I answer that, I'd like to just say one thing about guardianship, because I had a client who had none of those papers, those documents, important documents. She was a nurse and should have known better. But anyway, her estranged sister became the guardian, and it cost thousands and thousands of dollars. Plus, it was extremely time consuming to go through all of that. And it held up a lot of things that the nurse, the sister, needed. So I totally agree with my colleagues how important these documents are. So having these documents, and if the loved one is in need of transitioning to a facility like assisted living or a memory care facility, the person who was appointed the power of attorney will be making those decisions if the loved one cannot. So I would be talking with the daughters, if they are both as the power of attorney, and advising them with certain criteria that is needed for me to make the right advice to them. Like I would need to know more about the medical situation of David. I would like to know where would they like him to go? In other words, the location. Are they looking to have him placed in a facility that's within 20 minutes? What did he do in his previous life? What hobbies may he be that he had, so that I can form a plan based on his wants and needs. And then I have to consider what the budget is. Luckily, he has long-term care insurance, which helps a great deal. But sometimes people don't have the long-term care insurance and they have to privately pay. So I would have to work with a budget and put all these criteria together to help them find the right place.
So so we have a lot of balls in the air right now in our case study, because Donna, you're at the finish line with the right place for David, and we know ultimately that's what has to happen. Meanwhile, to get to you, we still have to figure out what the care plan is for both spouses here, and where the role of home care is. So I'm going to circle back again and push everyone to, and I think Randi, Lisa, tell me how if I am a potential Amy or Beth, tell me, how do I get to the point where I am in Donna's office helping to figure out the ultimate residential plan? What has to happen first, and how does that work?
So, from the home care perspective, we often have couples where the couples are in different medical status, and we have the way it works with us is that we have a nurse that goes in to do an assessment with the family members. It could be in the rehabilitation center and the husband at home. So there would be 2 visits. There would be an assessment of their capabilities, and then what is the care plan? What needs to be done with them? Facilities and home care, they serve different purposes, and they both have they're both very necessary. We just coming out of COVID, where staying home was the thing that people wanted to do. But there's a time when somebody like David perhaps cannot stay at home any longer because Carol cannot take care of him, and maybe even having a caregiver at home isn't enough. Sometimes someone with dementia can be cared for in their home, but sometimes a social environment where there are other people and activities other than activities of daily living and going out for a walk and watching TV, maybe that's not enough for that person with dementia, and a facility is the right place. For someone like Carol, being at home, it could be the right place for her if she's able to rehabilitate and continue to be independent as she was prior to her fall. Sometimes people move into facilities together because their couple still wants to be together. So there are lots of pieces. And I would sort of start with the issue of home care. In this case, Carol fell, she had a medical need, and she's going to come home, and hopefully she's going to rehabilitate. Somebody like her might need live-in care at the beginning, and then as she increases in her abilities, the number of hours would diminish. So sometimes we work with somebody like this who they have a live-in caregiver, and then the caregiver we change to daily care. Sometimes we do then every other day, sort of helping to transition into independence. And that's a wonderful thing. I have to say, that's really what we look for when somebody has a medical issue, and they improve, and we diminish the number of hours, and they're back to their independent life. In a case like David, we sometimes start with 3 hours, three times a week, and then suddenly we need to do 5 times a week, and then we need to do live in, and then sometimes we need to transition. And then I go to Donna and say, Donna, this is the case, this is the situation. You know, where's the rest? You know, what's the best plan for this family? I'll say something about financial. Home care and facilities are expensive propositions for someone who doesn't have long-term care insurance, or they don't have adequate financial resources themselves. And I'll just, you know, a warning that I would like to say, and it's a lot of times people will say, I'm going to find a private caregiver. And a private caregiver is usually less expensive than using an agency, any agency, not just Home Watch. But there are things to be concerned about with privacy. Sometimes you have a wonderful, wonderful private caregiver. But what happens when that private caregiver wants to go on vacation for 2 weeks? What do you do? What happens when that private caregiver is not doing their job? There's no oversight. In this case, both of the children, both daughters, are living far away. What's the oversight? Who's checking in to see that everything's being done properly? When you have an agency, the New Jersey regulations state that a nurse must come to visit at least once every 60 days. That's not so much, but they do check in. And of course, we have a philosophy that we want to get to know the family and meet their needs. So a nurse visits every 30 days if everything is going well. If there's a problem, they call and the nurse is there that same day. And then in our case, we also have a social worker. I'm one of the 3 social workers who also help the family with all the other issues. So if we are called in just by ourselves to come in and do home care, and then we see that there are other issues that need to be taken care of, I would turn to Lisa and say, Lisa, there are other issues that are not things that we do. And then Lisa, I would sort of refer to Lisa. In another situation, I would say, you know what? Home care is not enough right now for David. Donna, I need your help.
I would be happy to help. I just want to say that in this situation, being that they are a couple, I would be looking at facilities first for David, because it seems as though Carol is more alert and hopefully will be, with the help of Home Watch, get back on her feet somewhat. So the type of facilities that are available to them would be continuing care retirement community, which is also known as a life care community, where they have 5 levels of care, which include independent living, assisted living, memory care, long-term care or nursing, and subacute. So they don't really need the independent part of it, which is a buy-in, and of course that is very expensive, but they have assisted living, which down the road could work for Carol, and David could be in the memory care unit. And as Randy mentioned, with dementia, it does help a great deal to have more of a structured routine every day. I did work in a memory care facility, and the activities that were provided were amazing, because it was all based on their cognitive level, and the residents enriched their lives with that type of routine. But if they cannot afford to go to this particular facility called the CCRC, there are assisted living facilities that also offer a memory care unit. And, you know, when Carol might be ready to make that transition, she could go to assisted living and David would be in the memory care, and they're both under the same roof. Of course, they would have to be assessed by a nurse to see where their level of care is needed. And I know, after being in this industry for 20 years, many people do blossom in assisted living and in memory care. They make friends and they have the social activities. And, you know, you can go to assisted living even if you're really not in need of care. I worked at one and we had people who were working part-time and were driving. It's just that they like to know that the services that are offered, like doing your laundry and having your meals prepared, and other services are there when they need them. So I just want to say one more thing. I want to thank Michelle. I've known Michelle for a while, and thank you for inviting us. And I am very honored to work and know Randy and Lisa and Meryl. I didn't get a chance to say that before, so I want to say that now. And thank you. Thank you very much. And please ask us questions. We're here for you.
I just want to circle back, and I definitely don't want to preempt questions from all of our participants today, but you know, as a lawyer, I have to, you know, have to poke at all the holes. So it sounds like, Randy, imagine we have the most, you know, we have a perfect, well-oiled machine for home care in place because we've consulted Home Watch. Donna, we've got David at a great place where, you know, where his memory issues are well addressed and he's able to function at the highest level possible. So then my question is, Lisa, have we solved all our problems? What's missing? Can Amy and Beth go on a year, you know, trip around the world now and just let everything run itself? Where are we?
So a little bit, you know, I know that geriatric care management might be something that is, you know, not a familiar term. It's not something that people have heard of. And, you know, I've been doing this for over 16 years, and I can't tell you how many times people have said, well, I wish I knew that this kind of service was available or this kind of person was available to help. The role of a geriatric care manager is to act as almost like a general contractor. So, you know, let's say I'm lucky enough to have met Carol and David and Amy and Beth in the hospital when the first event happened, when Mom fell. My role at that point would be to make sure that Carol got everything she needed while she was in the hospital, perhaps even starting with the emergency room, making sure that she got, you know, her bed as soon as possible and all her consults and every test was run that should have been run, and that she's not being discharged too soon, because maybe there is, and all these things are from clients I've had hundreds and hundreds of clients over the years. Maybe there was an undiagnosed urinary tract infection, and we just needed one more test to determine, you know, something else. You know, again, it all goes back to a safe discharge. So we want to make sure that the experience in the hospital is the best that it can be. Recognizing a hospital is not the Ritz-Carlton. So, you know, a lot of times, you know, people have expectations that about certain things, but managing the expectations at the hospital, making sure that the patient receives the best care, that the communication between the family members has taken place, with or without the documents. There are documents that can be signed in the hospital in a more of an acute situation that give authority to make decisions and speak on Carol's behalf or along with Carol. Because she's going to be recovering. She's going to be post-surgical. She's going to be on pain medications. She's going to have, you know, possibly a roommate with things buzzing all day long, 24 hours a day. And, you know, a roommate who may have her own set of circumstances and family coming in and out. So communication is really key. Then we want to make sure that a person goes to the appropriate subacute. And it really, you know, every step of the way, kind of having a guide or a coach there with you, kind of saying, these are the things you want to think about. So now a person is discharged safely from the hospital and they're going to the subacute that is right for them. And we then are doing the same thing all over again, making sure that the stay at the subacute, the person's getting everything that they need, that they're getting their physical therapy. Maybe they haven't ordered occupational therapy. Maybe a person is having trouble swallowing. Care manager may come in and say, you know, hey, can we get a consult with the speech person, or bring in, you know, a specialist to help with something else. Then the care manager's role is to, again, make sure, facilitate the communication amongst the family members and the patient and the providers, and work on a safe discharge. We talked about possibly, in this scenario, an appeal, but let's say, person's ready to go home. Make sure that the durable medical equipment is ordered ahead of time and is actually there. Make sure that the home care is in place. And when working with Home Watch, I know that's going to happen. We often have the caregivers sometimes are right at the facility picking up a person upon discharge, or at home waiting so that they can literally help to get a person from the car into the home. And you think about that, well, what does that matter? But that's something that really takes some planning and coordination because, Carol may be using a walker and her daughter is picking her up, but maybe her daughter is not so comfortable spotting her or helping her get into the house. So we want to make sure that the caregiver is there right from the get-go. They get into the house. We want to make sure that all the medications, they can't send them home. They can't send someone with physical medications from the hospital to the rehab or from the rehab home. Every time there is a transition, they have to be reordered from whichever pharmacy. So whether it's the hospital pharmacy, whether it's the pharmacy that the rehabilitation center is using, or whether someone's going home and they're using their community pharmacy. There are a lot of, and then there are a lot of like medication issues. So, a care manager or a family member needs to really be on top to make sure that every medication, and not just the medications, make sure nothing's left, make sure the dosage is proper. I've had people discharged from the hospital with like a 4-hour catheter and they were sent home and goodbye, good luck, and now what happens? I mean, if any, it has to be changed every 4 hours or emptied, and then there are risks. So there's a lot of coordination that takes place all along. And, a care manager, and I will just say, I work in New Jersey, I work around the country, but there are care managers. I'm part of the Aging Life Care Association. There are care managers in 50 states and including, overseas. And so we have a very robust listserv where we get ideas from each other and we share resources. So, I'm routinely recommending people in Florida or in other parts of the country to work with families, or just even simply have a consult. It's not like you have to sign up, for forever. So that's a role that the family or, a care manager, if the family, kind of is able to take on that role, to engage a care manager can do. And then you get the person home, family goes home. Who's going to be the boots on the ground? Who's going to take that person to, let's say, there is a full-time live-in caregiver, they go to the doctor, but is it really the responsibility of the caregiver to have to also now manage the medical care piece of it? We may be asking a lot of her, to have to do that. And I kind of think it's not fair to put that responsibility. A caregiver they are highly trained, they're certified, they have a very important job to keep a person safe, physically safe. But when it comes to, what goes on in the doctor's office, it's always good to have someone else there. So if a family member can't be there, maybe they can call in. If they, if they want boots on the ground, perhaps they engage a care manager. And the care manager can literally attend the doctor's appointment, ask questions, sit in on the appointment, facilitate the communication between the neurologist, the primary care doctor, the orthopedist, and the children, and the patient. Just speaking personally, I had a couple, I tell this story, I had a couple foot surgeries, and I couldn't even hear what the doctor was saying to me, because by my second foot surgery, it was because the first one had gone wrong. And I really needed another set. I did not attend a single appointment without someone either there in person or calling in on speakerphone. And, and it's just, I'm sure it's the experience of many people here that it's always good to have someone else, be another set of eyes and ears.
I want to add something to that in terms of in terms of healthcare. The children, both of the daughters, they seem like very loving and caring daughters who want the best for their mom and their dad. But the first daughter got there and she needed to give her father a shower. That's not always the most comfortable relationship, and not everybody is willing or feels comfortable doing that. And I think that sometimes it's better to have a professional caregiver do those type of things and enable the family members to maintain their relationship as caring children or caring husband or caring wife, and not the person who's doing the showering and the toileting. That changes the relationship.
I think that's
Yes.
really important. I think.
I think so.
Go ahead, Donna.
Oh, I'm sorry. I didn't mean to interrupt you, Lisa, but I just wanted to say that in the case with the wonderful services that Lisa offers, keeping in mind that the daughters are long distance caregivers. So having someone local like Lisa or a care manager is wonderful. You must have an advocate. You must. I've seen so many scenarios that have gone wrong because the family was not involved, or maybe there wasn't any family. Don't forget, there are a lot of senior solos, as we call them. They have no family. So engaging with someone like Lisa and using her expertise and caring that she offers is really a wonderful benefit.
We
Thank
have
you.
Meryl, we have a question in
Yeah.
the chat box, so maybe you can respond to that.
Right. So actually tying right into that, speaking of, caring family, let's talk about the hard stuff for a minute, guys. We have in a situation where even a person does have caring family, care is not free. What should Amy and Beth be thinking about as far as how are they going to pay for the various kinds of care that their parents need, home care and residential and whatever else, care management, where do we find the money for all of that? I know part of the answer has been in my ballpark as far, as planning and selling long-term care insurance, but how do we actually start tapping those assets to help this work?
So in our case, we actually have somebody in our office that is the long-term care insurance person, and they help the family take care of all of the paperwork. They know, and we know, that the family is busy dealing with caring for mom or dad or husband or wife, and that filling out forms, and they just have to give us the name and the policy information, and we do all of the work for them. So it eases the process.
In your experience, is the cost of home care possibly covered by these long-term care insurance policies? Is there a gap? How does it usually play out for people?
Okay. In some cases, depending upon the policy, there are 30, 60, 90 day, I forgot what the terminology is, for somebody for the care insurance to kick in. So they do have to pay for the insurance out of pocket for that 30, 60, or 90 days before the care starts to get covered. And it really depends on the level of care that the person needs, number of hours, number of days, whether or not it can cover everything.
Right. And also there are what is called, there's a veterans benefit, aid and attendance, that could be used if the veteran meets certain requirements for that program. Of course, private funds are used, and every assisted living, memory care facility, and skilled nursing facility take long-term care insurance. So when the family, when the loved one rather runs out of money, as long as they meet the requirements of the facility, whether it's a 2-year spend down, they can go on to Medicaid.
So there's a Medicaid application process that they would need to go through, and there are people, specialists, that help with that process. Another thing that people do are reverse mortgages. And that's another way that people pay for, their home is usually the largest asset that they have. And so that's another way that if somebody doesn't have just private assets, it's another way that they can also pay for them.
So I know a number of long-term care policies have, set daily benefits or monthly benefits, whatever it is. How does a family get guidance in terms of figuring out when and how to spend that money to maximize it?
So that's actually something that I work a lot with, because having the legal background and the social services background, I'm able to review the policies and the contracts and help people go on claim. I'm dealing with a lot of appeals right now because people, thought they were eligible and they kind of went and applied and then they were denied. So there is a certain finesse to doing it the right way. With respect to working with home care, sometimes people they haven't hired the home care agency yet. And those are the people that I get involved with. And again, I also work with people all over the country on this matter. So, it wouldn't be necessarily Home Watch providing so they don't have that service inherent within the home care agency. So there is a finesse to getting people not just on claim, but reducing that elimination period, which is what Randy was referring to, the 30, 60, 90. I've looked at hundreds and hundreds of policies over the years, and I've yet to find two that are the same. So there is no general answer to that. Some of them are indemnity policies. Some of them are daily benefits. I will also say that, kind of just going like, how do I pay for care? So, let me just, whether it's home care, facility care, care management, yes, private funds. So if a person can kind of self-insure and pay for their own care, that's number one. If a person has a long-term care insurance benefit, I'm going to say 9 out of 10 times there may be a reason we don't want to kick it in right away, but there's usually I would say I recommend that people start their policies ASAP, because they're use it or lose it. So if a person unfortunately were to pass away, like what's the point of kind of waiting on it? That's generally been my experience. There's been, a couple times that I've said maybe we should wait or we should do this first. That's long-term care. I can't give anyone here tax advice, but I will say that generally home care, facility, most of the facility care and always care management counts towards there's a deduction that your accountant may choose to take with respect to healthcare costs over the years. So there's something you have to consult with your tax provider on that, but I'm always asked to give a kind of rundown of the yearly charges and what we did, and then the accountant uses it as he or she sees appropriate. Another way to pay for care, so we have private pay, long-term care insurance, tax. Now, long-term care insurance will pay for typically home care. I had a client last year where the only benefit she had on her long-term care insurance policy was nursing home. In maybe 30 years ago, and that was the only, and we called and we said, well, do you have an alternate, because now like assisted livings in the past 30 years, they weren't really around. So a lot of the companies kind of adapted and added their addendums to allow for home care, assisted living care, alternate plans of care. You might see some of that language in the policy. But in this case, it was only nursing home, and the woman lived in her own home and she desperately wanted home care. She didn't want to go to a nursing home. She had a dog and she had all her faculties about her, and she lived in her home and that's where she wanted to stay. And she couldn't use her benefit unless she wanted to go to a nursing home. Long-term care insurance also 9 out of 10 times pays for care management. And that is something that even long-term care insurance, people who sell the insurance don't know about and don't tell their customers. So sometimes it's called care management, sometimes it's called care coordination, sometimes it's called care advising. Again, it's a benefit that you have under your long-term care insurance policy. Why wouldn't you use it, right? So it's there for people who have the long-term care insurance. If Donna alluded to a veteran's benefit. So there's the aid and attendance benefit that is there for both the person who served and I believe his or her spouse. So there are different benefits that are available. There are also sometimes home care benefits, certainly medical benefits. I mean, I have had clients who had traditional Medicare and had the supplemental benefit, supplemental insurance on Medicare, and they also were vets. And they would go to get their very expensive medication. I mean, people on this call, and I don't see a lot of your faces, but you remember the donut holes and what was going on with like you had to reach a certain max, and then there was this gap where you had to pay for all your medications going back. So sometimes, people would get certain things done at the vet hospital, vet facility, and other things done in different places. And then lastly, Medicaid. So we don't want to make this a Medicaid talk. We specifically, kind of discuss that. But Medicaid is the only federal program that pays for long-term care. So if it's providing a home care in the home, or providing assisted living coverage, there's the Medicaid waiver program. If a person is eligible for in the long-term care facility, such as a nursing home, again, Medicaid is the only government program that will pay for long-term care. There are two qualifications. One is a financial resource and income limit. So a person, you have to be really impoverished. And I'm going to answer the question from the person in the chat on that, because I think that's where he or she's going with it. There's also a medical requirement. So a lot of times when people are thinking of Medicaid, they're thinking only in terms of the financial. And there's a lot of push, certainly with the marketing out there with attorneys to talk a lot about the Medicaid financial piece of it. There's also a medical piece of it, and that cannot be forgotten. So you have to, be able to qualify medically for services, whether it's in-home services, assisted living services, or nursing home services. You have to be able to qualify medically for that. It's not just a financial. So the question about, should I put my mom's home in a name? I think that was the question, right, Meryl?
Yep.
Yeah.
It's not so simple. First of all, people do it wrong. I'm not here. I do not provide legal services. So I am a barred attorney. That is not what I offer right now. So when I tell you this, I'm not trying to drum up business for myself. However, it can be done really, really, really wrong. And if it's not done right, and I mean really done right, people can find themselves in a worse situation than if they had never done anything. Okay, because if that money is transferred and it's not done properly, or the proceeds of the house or the house itself, and it's not done properly, then there's going to be a penalty if the purpose of doing that is for Medicaid. Okay, so I'm going to leave you with that piece of it. I don't know if anyone else wants to weigh in on that.
And would you suggest that they address an elder attorney to do that, and also to deal with their accountant?
Yes,
Yeah.
that is the best. I'm sorry.
Because it's not just about the house, it's about the whole financial picture, and it has to be part of a coherent plan. So definitely, many of us work with elder care attorneys on a very regular basis, happy to provide resources outside of the seminar for that one. But we do have another question in terms of, we've talked a lot about, well, what does the long-term care policy, what might it actually pay for? What does it cover? I know, Randi, you say you have someone at Home Watch who, if you're looking for the long-term care, will take a look at the coverage for regarding, what the long-term care policy matching up to Home Watch. Donna, I know I'm sure you help that conversation along with the facilities. Are you guys aware of anyone who just generally takes a look at long-term care policies as a starting point?
I was under the
I think that's
impression that
true.
Lisa can do that.
So if they're not already working with, a home care agency and they want just an exploratory call to find out what their benefits would be, that is something that I work on.
So that it looks like that's what Jackie and Perry are saying.
Right.
And I think that it's true, Meryl, right? That it's good to have a look at your insurance policies years later, because things change and society changes and your situation changes. So Lisa could do that, and even your insurance person who you bought it from to go back and talk to them.
It's important to review what the policy covers, because most people don't know what it covers. And
Yeah,
you might be
unfortunately,
surprised.
Many of these policies are old.
Right.
And so the agents and brokers are no longer available. And not only that, the companies themselves that issue the policy have gotten out of the long-term care business, so long-term care insurance business. So it is it's a great product. I literally do a jig and a happy dance when my clients have it. But so, I'm all in favor, and I don't sell long-term care insurance. But there, as I said, there could be a certain finesse. So if you're not already working, with Home Watch and, where they have someone on staff and you need someone to do it with you, that's a service.
Yeah. I think, that also goes to the prevention part of this program too. And I know we're getting over time, but I think when it comes to with all of the strategies and resources that we're offering, I think looking at your long-term care insurance policy before you need to use it, or even your life insurance policy, or in knowing who's really good out there in home health care, knowing who's really good out there as far as residential options and advising, knowing that what a geriatric care manager is, and the benefits to consulting on upfront, all of that ties into the prevention part of what we're talking about today. And the more you know before you have to avail yourself of any of these services, the more calmly and methodically and smoothly the process can be handled if something happens. So at least that would be, again, for me, I'm back to the ounce of prevention, because it's never fun to see someone come through your office in crisis. And I guess that's my my thought.
And if I could just add, Randi and Donna are very generous with their, recommendations and suggestions. And I know that, any of the four of us would be happy to speak. I know that we would all, be happy to give you names of people if it's outside of our scope.
Right.
I'm regularly going to Randi and I'm like, okay, I need someone in Bergen County, who do you recommend? So it's not just about, it's really about education, creating the best team that you can. And in the end, it comes down to quality of life, and oftentimes life and death. I know that probably all of us have been in the situation I have, where the advocacy that, we were able to provide, certainly as care managers in a hospital setting, has made the difference between life and death sometimes. And it's a very awesome responsibility. It also makes my job worth it. So when we're able to help, because it can be, quite frankly, like not a happy day, sunny day all the time. But when you're able to help a family and help a caregiver and have a positive outcome, I know that that's something that we're all in it for. I mean, we're not working in hedge funds. We're working in elder care. And so we are person-centered, patient-centered, and we're doing this. These are labors of love for all of us.
Yes, I can second that. After 20 years of doing this, when I help a family and I see how their loved one or themselves blossom, that's a great day for me. Definitely. I totally agree with you, Lisa, and Randy, and Meryl.
Are there any
Thank-
other questions? Well, you have, Michelle sent out information with all of our contacts. So if questions come up, please feel free to call any of us.
Yes, thank you.
I love that. Thank you, Lisa, Meryl, Donna, and Randy. I love that knowledge is power and planning ahead is important. And that does prevent the stress that comes later. So it may feel a little stressful now, right? But it's definitely going to help in the long run. So it's one of those things we always talk about, how people don't want to talk about it.
That's right. There are those conversations that some people don't want to have, but we have to have. We have to. Yeah.
Yep. So thank you everybody for putting this together for us. Hope you took notes. Again, I sent out the contact sheet just now in an email, so you have everybody's contact. And if you have further questions, you can dig a little deeper. Okay. Thank you again. Thanks so much.
Thank you,
I'll
Michelle.
see you again, Randy, hopefully soon. And Donna, definitely give me a call and we'll talk.
Well, and thank you for having us. Thank you.
Thanks,
you
Lisa.
so
Thanks,
much.
Meryl. Thanks,
Have
everybody.
a great day, everybody.
Yes,
Okay.
everyone enjoy, stay safe.
Also, I just
and
want to let you all know
record
that if you wanted to get into the nuance again and re-watch this, I'm going to send this for the recording will be sent and hopefully will be made into a YouTube video. So, and thank you again to Sharon, Beth, and Marie Claire, because you may wind up, YouTube
Sure.
star.
Michelle, would you send it to us as well?
Sure.
Yes,
Sure.
that would be great.
Thank you.
I would love to see that.
Yeah, they
Yes.
usually edit it and package it very nicely. So,
Okay, wonderful.
yeah. So get ready for your close-ups, because the Emmy Awards, the YouTube Awards will be coming up.
That's right.
Okay,
Right.
thank you.
Enjoy this beautiful day, everybody. It's beautiful out there.
Yes, enjoy the
Take
weather.
care.